I am, together with Dr. Medicine, we set up the fecal transplant program in Edmonton. And so our initial goal was to treat patients who have recurrent Clostridium difficile infection, just because these patients have very limited options in terms of really good therapy, and this has just been incredibly effective. And so that was we sort of set out this program as a clinical program, but then at the same time we also want to advance the science in this field as well, because there are just so many unanswered questions when it comes to fecal transplant. So far we know on the clinical side that this is incredibly effective, and it doesn't seem to matter who the donors are, whether it's familial donor, meaning that this is somebody who is related to the patient, or anonymous donor who is a complete stranger. Doesn't seem to matter. The other thing we have also learned through this project is that we have been able to detect the antibiotic resistant genes that are both present in the donor as well as in the recipient as well, but their profiles are completely different. And then we can show that through fecal transplant we can actually change the resistance profile in the patients, and after the fecal transplant they seem to resemble the profile of the donor. And the interesting thing about it is that in the donors they have fewer antibiotic resistant genes. The antibiotic resistance genes in the donors, they are not clinically important antibiotic resistant genes, whereas in the recipients they have, first of all, a higher number of these antibiotic resistant genes, and plus the resistant genes, they are the clinically important antibiotics that we actually use in clinical practice and in medicine in terms of treating patients who have serious infections. The hope is that perhaps one day we might be able to use fecal transplant, the stool material harvested from a healthy individual who has very few antibiotic resistant genes, and then by transferring that material into a patient who has multiple antibiotic resistant organisms, and we simply just don't have a very good treatment for these individuals, just because if there are carriers of these sort of multi-drug resistant bugs, so to speak, they can potentially run into very serious problems. And then maybe through this mechanism we can eliminate those organisms. We kind of thought this might be the outcome, but we honestly just don't know for sure, just because this is something that has never really been done before. But we do know that there has been some case reports where other investigators have seen that through fecal transplant they're able to eliminate these sort of multi-drug resistant super bugs, so to speak. And so we kind of thought perhaps this could be what we may end up seeing, but again, we just didn't really know the mechanisms of it. But through this study, which is again very preliminary, and we are hoping to expand upon our findings, so it sort of confirms that perhaps we are on the right path. Well, fecal transplant is a very exciting biological agent. That's sort of how the FDA is classifying fecal transplant at this point. It has potentially other indications for treating other disorders as well, such as inflammatory bowel disease or irritable bowel syndrome, and maybe psychiatric or neurological conditions. This has been the most exciting area that I've been involved in, both clinically as well as in the research front. It's a it's an area that's still sort of in early stages, and there's so many things that we don't know about it just yet, and that's what makes it so exciting.